this is a very important part of what we call standard of care. And standard of care has been published, and this is three recent papers published in Lancet Neurology. A key element of standard of care is to work as a team, right? Which we are doing today, right? To work as a team that involves the physiotherapist, the occupational therapist, the psychologist, the nutritionist, and of course, all the different consultants, not only the child neurologist, but the cardiologist, the respiration team, and the orthopedists. We need to consider the patients in the center of this target, and we need to have a patient-centric approach, and to collaborate with the different specialties and with the different healthcare providers to provide with a holistic management of these patients. I think that an important part of the management is also sometimes to manage the expectations. And there's a lot of information flying around, and there is a lot of excitement. And this is good, because if there is no hope, it is quite terrible. So I think that we need to respect the hope of families and the excitement that can generate some communications. But we need to also to manage these expectations when it comes to new treatments, for which sometimes families are ready to make incredible things like relocating, selling their house, or even coming to a trial. And I think that it's also very important to be clear with the families that a trial is a trial, right? And a trial is done to answer a very simple question, like, does it work or not? Is it safe or not? And if we have the answer before asking the questions, then there is no way to run a trial, right? So it's a difficult balance, but it's a balance that we need to provide the family with, is to respect the hope, to work with this hope, but also to manage properly the expectations.